Well, today we'll discuss about anatomy of ear and mastoid. This is a common topic in the final exam for both MBBS and MS ENT students. Ears are paired sensory organs which comprise of auditory system, which is involved in detection of sound, and vestibular system, which is involved in maintaining body balance and equilibrium. Ear can be divided anatomically and functionally into the external ear, middle ear, and the inner ear. Here you can see one is the external ear, pink is the middle ear, and the gray is the inner ear. Okay, and this is the knob, earth knob. Okay, all three subdivisions are involved in hearing, and inner ear is involved in body balance and equilibrium. Therefore, ear helps both in hearing and body balance and equilibrium. Now coming to external ear or the outer ear, the protruded part of the ear is called as the pinna, which is a framework that is formed by yellow elastic cartilage, except in the lobule, this is the lobule, and in the incisor terminalis. Incisor terminalis is the part of the ear which is in the anterior aspect and devoid of the cartilage. The function of pinna are to collect and direct sound waves through the ear canal to the tympanic membrane to protect the tympanic membrane from the external sound. The perichondrium of pinna can be used as the graft material for middle ear and other reconstructive surgeries, and even the cartilage is strong and can be used for reconstructive surgeries as well. Coming to parts of the pinna, helix is slightly curved rim of the auricle. Antihelix is broader curved eminence anterior to helix. Concha is the deep cavity in front of antihelix. Sigma conchae is the depression between the antitragus and ascending cross of the helix. It is the surface landmark of mastoid antrum. Mastoid antrum lies around 1.5 to 2 cm deeper to the sigma conchae in adults. Tragus is a prominence in front of and partly closing the external auditory canal. The lobule is the lower portion of the pinna, which is made up of areolar tissue and fat without cartilage. The sensory nerve supply of the pinna. The lateral surface of pinna, the upper two-thirds is supplied by auriculotemporal nerve, which is the branch of cranial nerve 5, and lower one-third is supplied by greater auricular nerve, which is the combination of C2 and C3. The medial surface, upper one-third is supplied by lesser occipital nerve, C2, and the lower two-thirds is supplied by greater auricular nerve, C2, C3. Therefore, most of the part of pinna is supplied by greater auricular nerve, which has significance while applying local anesthesia in the ear surgeries. Posterior concha and the antihelix are supplied by auricular branch of vagus, and the facial nerve supplies small region at the root of the concha. Coming to external auditory canal, you can see this is the external auditory canal here. The external auditory canal extends from bottom of the concha to the tympanic membrane. It is 24 mm long in adults, with lateral one-third, that is 8 mm, which is cartilaginous, directed upwards, backwards, and medially, and the medial two-third is 16 mm, which is bony, that is directed downwards, forwards, and medially. Pinna is to be pulled upwards, backwards, and laterally to straighten the external auditory canal in adults during examination. Only cartilaginous skin has hair follicles, ceruminous glands, and pyrosebaceous glands that secrete wax. Therefore, wax is always present in the cartilaginous external auditory canal. The cartilaginous fissure of Santorini and bony foramina fuscae are present in the anterior wall of the external auditory canal that might lead to infection spread or metastasis from parotid or to the parotid from the ear. Coming to anatomy of the middle ear, the middle ear cleft contains middle ear cavity, atic, petrous, and antrum, mastoid ear cell system, and the eustachian tube. The middle ear cleft develops from the tubotympanic recess. The middle ear cavity is the part of the middle ear cleft, and that is composed of epitympanum or atic, mesotympanum, hypotympanum, protympanum, and posttympanum. So all these regions are based on the appearance of tympanic membrane from outside. The region that is above the tympanic membrane is called as epitympanum, which is in relation to tympanic membrane is called mesotympanum, which is below the tympanic membrane is called as hypotympanum. Anterior to tympanic membrane is called as protympanum, and posterior to tympanic membrane is called as posttympanum. This is the cross section of the temporal bone with medullary cavity. This is the medullary cavity, and this is the atic, petrous, and the antrum. Okay, these are the mastoid system. Different ear cells are there. This is the jugular bulb, internal jugular vein, and this is the carotid, internal carotid artery, and this is the eustachian tube. The contents of the medulla are 3 ossicles, malleus, incus, and stapes, 2 nerves, chordae tympani and tympanic plexus, and 2 muscles, tensa tympani and stapedius muscle. Air, mucosal folds, and ligaments and blood vessels are also the contents of the medulla. The tympanic membrane is a partition between the external and the middle ear. It is obliquely set with an angle of 55 degrees to the floor. Its dimensions are 10 mm into 80 mm into 0.1 mm. So the TM is very thin membrane. The parts of tympanic membrane are pars tensa and pars plasta, also called as Suprameatal membrane. This is the pars plasta and this is the pars tensa, as you can see here in the endoscopic view. What are the landmarks of tympanic membrane? They are lateral process of malleus, which is the most important landmark of tympanic membrane and most consistent. This is rarely eroded by disease. Anterior and posterior malleolar folds. This is the posterior malleolar fold and this is anterior malleolar fold. Handle of malleus. This is handle of malleus. Umbo is the tip of handle of malleus. And cone of light, which is seen anterior and inferiorly because the TM is obliquely set with the anterior portion being longer. Tympanic membrane reflects the light towards anteriorly, so cone of light is always seen on the anterior inferior quadrant. Annulus tympanicus is the peripheral portion of tympanic membrane. There are different layers of tympanic membrane. First is outer layer of squamous epithelium that is continuous with that of the meatus. Middle layer of fibrous tissue that has radial and circular fibers, and the inner layer of mucous membrane that is continuous with the lining of tympanic cavity. Two important things here: the fibrous is disorganized and the Membranous is deficient superiorly as notch of Membranous. The pars tensa can be divided into 4 quadrants by 2 lines. One line passing through tip of the handle of malleus and the lateral process of malleus. This line, one line passing through it, and the next the tangent line which passes at perpendicular plane through the tip of handle of malleus, okay, in the first line. So first line and the second line. So this divides the tympanic membrane into anterior superior quadrant, anterior inferior quadrant, posterior inferior quadrant, and the posterior superior quadrants. What are borders of the medullary cavity? Question can be asked in the exam. Roof is formed by tegmen tympani. The floor separates tympanic cavity from jugular bulb. The medial wall promontory is the bulge which is formed by basal term of cochlea. Oval window communicates between middle ear and the vestibule of the inner ear, which is closed by footprint of the stapes. Round window communicates between scala tympani and tympanic cavity, which is covered by secondary tympanic membrane. This picture schematically shows different structures in different walls of the medullary cavity, most important being the medial wall that contains promontory, as you can see here. This is the prominent part due to basal term of the cochlea. Superiorly lies the oval window and inferiorly lies the round window. So more medially, again, the medial segment also contains the lateral semicircular canal, dome of lateral semicircular canal, and the facial nerve here. Anteriorly, you can see tensor tympani muscle and pharyngeal tympanic tube or the eustachian tube opening. And posteriorly, you can see this is the stapedial tendon or the stapes. And the facial nerve also lies posteriorly, and inferiorly lies the internal jugular vein, and superiorly lies the brain. The lateral wall is largely formed by tympanic membrane, and scrotum is also defined as outer aortic wall, which is more laterally, and sometimes bone inferior tympanic membrane is also seen in the lateral aspect, that is part of hypotympanum. The interior wall contains thin plate of bone with openings of canal for tensa tympani and the eustachian tube, and the posterior wall separates medullary cavity from the mastoid bone, contains petrous and the pyramid. The mastoid antrum is defined as largest and most consistent ear cell of the mastoidal system, which is well developed at birth. The relations of mastoid antrum are: roof is formed by part of the floor of fossa, floor is formed by digastric muscle and sigmoid sinus. The posteriorly there is bony covering of sigmoid sinus, And laterally there is squamous temporal bone, which corresponds to suprameatal triangle or McEwen's triangle, and Simakunke. McEwen's triangle or suprameatal triangle is a commonly asked question in the final exams, both in practicals as well as in theory, so you should know it in details. The boundaries of McEwen's triangle are: superiorly, it is bounded by posterior prolongation of upper border of the root of zygoma, also called as suprameatal crest. Inferiorly, there is posterior superior margin of bony external artery meatus, and the posterior line is the vertical tangent drawn through the posterior margin of bony external meatus to the first line. It contains spina Henle, and it is a surgical landmark for the mastoid antrum. The mastoid antrum lies 1.5 to 2 cm deeper to the triangle in adults. This is an important question to be asked in the final exam as well. You can see the McEwen's triangle here. This is the upper border, which is made by posterior prolongation of root of zygoma here, and the anterior-inferior boundary is found by the bony posterior canal wall. This is the bony posterior canal wall, and third line is tangent drawn from the second line to the first line. So this is the McEwen's triangle. Surgical landmark for the mastoid antrum, the surface landmark being Simakunke. The mastoid system is extensive system of interconnecting ear-filled cavities arising from walls of mastoid antrum that extend throughout the mastoid. It is lined with flattened, non-ciliated squamous epithelium. There are different types of mastoid ear cell system. They are: one is cellular or pneumatized, which is made up of honeycomb-like appearance on plain X-ray mastoid because of different ear cell systems. Diploic, the ear cells are interspersed with marrow-containing key spaces, so there are less amount of ear cells. And acellular, without ear cell systems. This is the plain X-ray of mastoid that shows the external canal, labyrinthine bone, and this is the mastoid system here, which is honeycomb-like, seen as honeycomb-like appearance. So this is probably the dural plate, and this is the sinus plate. Okay, sinus plate and dural plate. So these are the ear cell systems here. There are 5 recognized regions of mastoid pneumatization according to Alum 1969, and they are: middle layer containing epitympanum, mesotympanum, hypotympanum, protympanum, and posterior tympanum. The mastoid contains antrum, central mastoid, and the peripheral mastoid, perilabyrinthine, supralabyrinthine, and infralabyrinthine, petrous, apex, apical, and petrous, and accessory with zygomatic, squamous, occipital, and cerebral processes. Coming to inner ear. Inner ear lies within the petrous temporal bone. It is divided into bony labyrinth and the membranous labyrinth. The bony labyrinth consists of series of bony cavities within the petrous temporal bone. It is composed of cochlea, vestibule, and semicircular canals. These structures are lined internally by periosteum and contain perilymph. The membranous labyrinth lies within the bony labyrinth. It consists of cochlear duct, utricle, saccule, and semicircular ducts, and is filled with endolymph. Vestibule is the central portion of bony labyrinth, which is ovoid in shape, and oval window lies at the lateral wall, and utricle and saccule in the medial wall. Openings of semicircular canal, there are 5 openings. There are in posterior, superior, and inferior walls of the bony vestibule. There are 5 openings over here: 1, 2, 3, 4, and 5. See, there are 3 semicircular canals with 2 arms each, but the non-ampullated end of the posterior semicircular canal and the superior semicircular canal, they join to form the cross commune, which opens in the vestibule, and there will be 5 openings here. The semicircular canals lie in planes of right angle to each other. They have both ampullated and non-ampullated ends, and ampullated ends contain vestibular sensory epithelium and independently open into the vestibule. Non-ampullated end of the lateral semicircular canal opens separately, whereas those of superior and the posterior semicircular canal join to form cross commune before opening in the vestibule. Coming to bony cochlea, which is a coiled tube like the shell of a snail, contains 2.5 to 2 3/4 of turns. This is the bony cochlea. Height is around 5 mm, and the base is around 9 mm in diameter. The coils turn around the modiolus, which extends through the entire length of cochlea except for the helicotrema, which is a small channel at the apex. So this is the modiolus. Okay, so the coil turns around the modiolus. The cochlea contains three compartments, and they are scala vestibuli here, scala tympani, and the scala media, so-called membranous cochlea or cochlear duct. Within the modulus lies the spiral ganglion in the spiral form, spiral lamina. The cochlear nerve lies within the bony modulus throughout the entire length. So cochlear nerve lies somewhere here. The fibers go to the cochlear nerve. Coming to membranous labyrinth, which contains membranous cochlea, which is triangular in cross section and borders superiorly by Reisner's membrane, inferiorly by the basilar membrane, and laterally by stria vascularis, which secrete the endolymph. Uterine saccule, semicircular ducts, endolymphatic sac, and ducts. You can see here, this is the different tones of these are different tones of cochlea and cross section. You can see here, this is the scala vestibula and this is scala tympani, inferior one, and the scala media lying in the middle aspect. Scala media, vestibula, and the scala tympani. These are the nerve fibers. Organ of Corti might be asked in the exam as short note. This is sense organ of hearing and which is situated in the basilar membrane. So this is the basilar membrane where the organ of Corti is situated. The components of organ of Corti are: one is tunnel of Corti between the inner and outer hair cells, then hair cells, outer and inner hair cell bundles, supporting cells like Dieter's and Hansen cells, and tectorial membrane. So when there is flow of endolymph or perilymph and when there is distortion movement of the tectorial membrane, then hair cells will move and there will be generation of the action potential that will be transmitted as the electrical impulse to the brain through auditory nerve. You can see here this is Reisner's membrane here, and this is the organ of Corti. These are inner hair cells, outer hair cells in different groups or rows. Okay, and the supporting cells are there. Difference between inner and the outer hair cells. The inner hair cells are around 3,500 numbers. The outer hair cells are around 12,000 numbers. The inner hair cells are in a single row, whereas outer hair cells are in rows of 3 to 4. The inner hair cells are flask-shaped and outer hair cells are cylindrical. The inner hair cells are primarily efferent type, whereas the outer hair cells are primarily efferent type. The functions of inner hair cells is to transmit auditory stimuli, whereas the outer hair cells function to modulate inner hair cells themselves. The inner hair cells are more strong and they are resistant to damage, and outer hair cells are more vulnerable to damage and they are weak. Thank you so much. Please subscribe to my channel, Dr. Krishna Koirala, for more videos on ENT classes for MBBS as well as MS. Thank you.